Anti-vaxxers logic challenge update.
Throughout history, human perception has shaped the way we understand the world. What we seek, we often find, not necessarily because it was absent before, but because we have been trained to recognize it. This principle, known as the observer effect, plays a significant role in many debates, including discussions on vaccines and health conditions. There are those who argue that the rise in certain diagnoses, such as autism, is linked to vaccines. As evidence, they point to the Amish community, which largely forgoes vaccination and seemingly reports fewer cases. On the surface, this may sound compelling, but deeper examination reveals that this conclusion is not as straightforward as it appears. First, the Amish and Mennonite communities often maintain closed gene pools, meaning their genetic diversity differs significantly from the general population. This alone can influence the prevalence of certain conditions. Additionally, their approach to healthcare is distinct, often relying on traditional methods or limited access to specialized medical professionals. Without widespread screening or formal diagnoses, conditions that are commonly identified in the broader population may go unnoticed or categorized differently in their communities. This leads to an important point. When we do not actively look for something, we may assume it is absent. Increased awareness and medical advancements have allowed us to detect conditions that were once overlooked, leading to a rise in recorded cases, not necessarily an increase in their actual occurrence. Misinformation often thrives in spaces where observation is selective and data is misunderstood. While skepticism can be healthy, critical thinking is essential. Rather than assuming causation based on surface-level comparisons, we must examine the full scope of genetic, environmental, and medical factors at play. Let's approach such discussions with open minds and a commitment to truth, ensuring that observation is guided by reason rather than assumption. Thank you.